Hey there, Bridget Lynn Dolgoff, Conscious of Economics and Urban Farm Project. And I kind of want to just do a simple video today about something that's been kind of bothering me. So I've been doing basically traditional osteopath medicine for years and years and years and years. And I was trained by non-medical doctors who are trained by people that, the lineages go back. So before the AMA was in place, they had traditional osteopaths. And these were doctors that used their hands to fix and correct the body using multiple types of medicines or types of methods, right? So usually there's like 4 components. One is kind of an energetic component that's done to the brain stem to help the flow of cerebral fluid to the brain and increase the pulses in the body or the chi to correct. And the idea is to take the person back through their timeline and heal everything that wasn't healed or corrected from the moment of their birth trauma or birth when they were a fetus. So when the AMA came around, they decided to, move osteopath under their jurisdiction. So you have DOs. Not all DOs are practicing traditional osteopathic medicine. So on top of all that, all my training and apprenticeships. I have 25 certifications from all different kinds of healing. I come from old bloodlines of different kinds of healing. Also really big in nutrition, so study biodynamic farming. Over certified, over credentialed, and I do have Western credentials. And I have done medical home health care and home health care with quads and paraplegics and, for dying family members and other types of home health care in the past. So I have, quite an extensive background, but I'm not a medical doctor. I don't want to be a medical doctor. I'm a healthcare practitioner, period, end of story. If you want to put it into those terms. So one of the things that has been happening this year, so in the past, I do work on animals as well. In the past, so let me go back real quick. So usually in my sessions, I do some, skeletal reprogramming. Alignments, brain reboot, tissue work, energy work. And my traditional osteopath has evolved, based on my teachers and my education and my instructions. So I even do an older type of cranial sacral therapy, which is called the Hopi method, which was developed, that I call the Hopi method. That was actually developed by natives. And then people picked it up and created a school around it and charged people to teach them. And you have to get certified. Oh, and you got to have a license, right? Yeah, whatever. Sometimes, you can be educated all you want, but you have to have a gift. You have to have a talent in touching people and unraveling them and finding out what the issues are, whether they're mental, emotional, physical, or spiritual. And some people are broken. I have a story I tell. I had a friend of mine who was a forensic psychiatrist who worked in the maximum security prisons. And when I was in my early 20s, he's now gone. He's an Inuit, native man, highly educated. And his job was to get the, serial killers to cathart, And he tried all kinds of different stuff because his education, wasn't working on them. And he tried like types of foot baths to stimulate the pituitary gland, all these different things. And he started 25 years in. He did this work for 50 years. 25 years in, he started doing astrology charts, and he started plotting their natal charts. And he said, some people are scrambled from when they come here before birth. For whatever reason, they're scrambled, and their planets are scrambled. And there's no way to unscramble that because it is what it is. So there are people and animals that are unscrambable. Scrambable. You can't unscramble them. And at a certain point, working with them, you're going to know that they may need actual medical help. They may actually need medication. They may actually need a surgery. And also there's this belief system that's involved. If people believe medical doctors can fix them and a surgery will be beneficial for them, then that's probably the road that they should go down. Like, it's not my job to fight them or try to educate them. But, down the road, I'll see them back in my practice. So this year, over the last year and a half, I have seen a horrendous amount. Majority of my practice has been infants, toddlers, and children. And they have a lot of different issues that I've never seen. And some of them I think are chemtrail related. A lot of them are birth trauma. I have no idea what they're doing in the medical field as far as birth is concerned, mainstream birth. Because these infants have, spinal conditions that are like a 45-year-old person with, in massage or some of the alternative stuff, they call them compressions. Chiropractors call them subluxations. And medical doctors call them herniated or slipped discs. So this is another thing, is because they separate all these different categories of education, they change the vocabulary of the condition in every single one of them. So it confuses people, and people don't know what the hell is going on. So you go to a chiropractor and they say, oh, you have a subluxation. You come into my practice, I say, oh, you have a compression. You go to the medical doctor and they say, oh, you have a herniated disc. You don't know what they're talking about. You don't know what anybody's talking about, and you're confused. It's called chasing your tail. So they have different vocabularies, different explanatory language for the different practices that there are. And this is meant to confuse you, right? So it makes people look like liars, or they don't know what they're talking about, or charlatans, or whatever else it's going to be. So the language is what really confuses people, right? So there's been a lot of things that I've seen, things that I can't correct, gray spots in the white parts of the eyes, a graying in the top parts of the teeth. And I'm seeing these in like 2- and 3-year-olds. And if they have the gray specks, they have the graying on their teeth. And I think it has to be some kind of chemtrail thing. It has to have to be some kind of, thing that has been put into the DNA or chromosome in the early development of the bones and the tissue. But the part that really gets me is that you have extreme health problems in infants and early toddlers and children. And there's some shamanism. I do a lot of shamanism work in healing. And there's some theories that I have in that, but we're not going to talk about that right now. But when you have a, 2-year-old that has a spine of a 45-year-old that labored most of their life, there's some serious problems. You got some serious problems with the birth stress of the mother, because, you know, a lot of that is developmental in the fetus. So you got a lot of birth stress in the mother. You have birth stress coming out, and that could be, you know, elevated hormones, stress, because the baby is going to, you know, the mother's developing it cellularly. So whatever the mother is engaged in is, I mean, it's not like the fetus can look out of the womb and go, gee, mom, I think you're overreacting to this situation. It's not going to be able to do that. It doesn't have that perspective, or that it can't identify with the world around it. So it's relying on the mother's identification with the world that she's living in. So the fetus gets to respond to all the hormones in the cellular or lack of cellular development that's going on when the baby's a fetus, based on stress. So there's a lot of things that can happen in the course of that. So then when the baby comes out, I mean, obviously the birth trauma is horrific, because these babies have these spines that have numerous compressions in them, which are where the spine is not straight, but there's curves in them, right? In some cases, 2 or 3. So usually the average 40-year-old person will have 5 compressions, where basically the nerve is pinched in certain areas where the spine is kind of collapsing, or what I call a C curve, right? And so it'll do that all the way down your spine. People will call it an S curve. Well, it's not really an S curve. It's like multiple S curves, like all the way down. Let's call it a giant, you know, snake turnabout, or what was I calling it the other day on one of my clients? I was like, oh man, dude, you got a major switchback going up your mountain, up your back. You got all kinds of switchbacks going all the way up. That's probably something a lot of people can understand, because if you've hiked a mountain, you're doing the switchbacks, right? Well, about 45 years of age, your back's going to be more like a switchback instead of a straight aligned spine. So these infants and toddlers and kids that are coming to me, because parents have no other option and they can't figure out what the hell is going on with the outcomes and the symptoms that these children are having, because the doctors have no idea. The doctors can't figure it out. Well, the thing is that the brain cannot communicate with the body, right? It needs a two-way system, right, to communicate. So if there's any kind of subluxation, compression, switchback, or herniated disc that's happened in birth trauma, the brain can't communicate with that area of the body. So what happens is that the brain will keep sending a signal there, because it's trying to develop it at an early age. And then the brain will go haywire, and it will send out, you know, symptom signals, because it can't communicate with those parts of the body. And those parts of the body are not being regenerated, right? They're not being communicated with the hard drive of the brain. So the body can't fix itself, because it's out of communication with the brain that has all the information. So that means that the tissue starts to degenerate. The nerve signals no longer exist. The muscle starts to degenerate and is no longer working. Okay, every system in the body is a muscle. And usually it's linked to a hydraulic pump, right? So the esophagus moves so you can swallow, you know, to get the food down to the stomach, right? The spine does the same thing. It's a hydraulic pump. It's pumping the fluid to the brain. It's keeping a constant pressure. You know, your colon is doing the same thing, you know. It's moving and pumping, and it's all connective tissues and muscle, and all these systems work together. So you have a compression in the spine. that nerve ending is no longer communicating with that part of the body. So the body's not being developed in that way. It's not being regenerated. It's not being restored. And you're in decay and damage. And it's basically dying. You know, those parts of your body are dying that have been disconnected. So say you were healthy and you grew up and your spine was in pretty good shape. Well, then you have like an injury. You were playing football in high school, or you fell down or had a car accident and you weren't fixed properly. Well, 20 years down the road, when your brain doesn't have a connection with your heart anymore because you had a whiplash and you have a compression, subluxation, herniated disc, you know, it's pinching that nerve. And so your brain no longer has a relationship with your heart. So guess what's going to happen? Your brain is not going to send messages down there every 6 months to go, hey, heart, time to regenerate. And after a while, the brain will just cut it off, because that's what the brain does. If it can't communicate, it will treat it like a stroke area, right? The muscles will seize up, the bone will deteriorate. The connective tissue deteriorates, and basically all the cells run amok and they start degenerating the area, right? So you start being composted. You're dying. Those areas are dying. So 20 years down the road, oh, I have an enlarged heart. Oh, I have leaky valves. Oh, I have, you know, blah, 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 blah. Well, of course you do, because your brain hasn't regenerated your heart in 20 years. And now you're dying, right? Should have been regenerated every 6 months, but it's not connected to the hard drive. It's not connected to the main system control. So everything regarding health, the basics are keeping the spine straight, keeping the spine fixed, and when you're birthed out, making sure that the corrective good measures are taking place so that it opens it all up, so the body has a perfect connection to the brain, all systems of the body. So for all of you people that are going to be pregnant, people that are pregnant, and people who have given birth or going to give birth, you know, check your baby's spine. If it doesn't look right to you, it looks turned at any place or anything else, make sure that you get help on corrective measures. And don't let your baby do this, be all crumpled up in a car seat. They do have head correctors that you can put in the car seat that will at least keep the baby's head straight while it's sleeping or in it. It still can turn its head. But don't let it crumple all up, right? Because the spine is developing. And if it crumples up now, it's going to be crumpled up for life, right? Because it's just, baby's just developing muscle response, structure, relationship to the hard drive. It's developing muscle tissue. So if you let it all slump over, not hold it correctly, especially when it's sitting, it's going to have some serious long-term spinal problems. So I'm becoming super concerned with what's happening in regards to babies and toddlers and children and the medical health system, because, you know, it used to be that they would damage a few, but let me just tell you, they are all showing up damaged. Like, I don't know. I saw so many this last year and a half that it just shocks me, and it totally upsets me. And really upsets me that doctors don't even have the basic knowledge. Like, they have no idea really how all these systems work, right? And they're trained that way, right? They're trained that way. So be careful. Get educated. You know, just don't have a baby and just accept the status quo. Find out more information. You know, help the baby. to develop, properly. And mothers, stay out of stress. If you can't stay out of stress, don't get pregnant. Because everything that you're going to undergo is going to develop the cellular structure of that fetus. And if you're highly stressed out, that baby's going to come out highly stressed out. And it's going to have a lot of chronic long-term problems. But there are people like me that can help fix those problems, right? But people don't take us seriously until it's, too late. Because, we don't have medical credentials. Well, some of the work I've been doing, some of the work I've been trained to do, some of the work that I'm educated to do, I'm an anomaly in the United States. Like, you go to other countries and you have like amazing people, maybe even better than me, doing work. And in socialized medicine, you get access to them on your insurance. In America, nah. Nope, you're not going to see it happen. So in order to have proper care, you are going to have to pay for it out of pocket. Yep. Back in truth. You will have to pay for because what insurance offers you, medical insurance, is not health. It is not health it's just not health. So in order to find your own health, you're going to have to educate yourself. This is going to be hard? Hell yeah. You have to wade through a lot of crap? Hell yeah. But if you find good health practitioners, stay with them, support them, because many of us are being murdered. We're being put out of business. I had 4 attacks by the state for no reason. I had never not one complaint against me. I mean, in most cases, I worked for free. Yeah. Because people couldn't afford help. So I've worked for free. So I've actually, made myself in a not a very good financial situation to do the right thing. So when people don't support us, we're forced to have to do something else. Like, I went back to school for biodynamic farming so I could learn to grow herbs in a really good way. And so eventually I'd have land and I could make my own herbal medicine, because all pharmaceutical medicine is derived from a plant source. So this was what I wanted to do. But then I got into soil restoration, nutrient density food, and other types of nutrition that aren't on the nutrition index. For example, sunlight, not vitamin D, just sunlight and the electrical charges of sunlight and how they respond to water and plants and the soil. Microbial medicine, that healthy microbial soil is a part of nutrient density in the body, right? Because it helps to keep the microbes in a good position instead of into a composting bad position in your body. So, I've had a huge amount of education over my life, and I keep educating myself and moving forward. And I'm always ahead of the turn. And so I think it's why a lot of people don't really understand my work until they experience my work. And then what will happen is that they don't support me because they think they can go get something cheaper. And then, I'll run into them like 10 years later and they'll say, what was it that you did? Because I've been trying to find someone like you for the last 10 years and I can't find anyone. Yeah, well, you should have supported me, You should have made an effort, to have a relationship with me, so I could be successful, I could be happy, I could be able to stand on my own 2 feet and have the basic needs covered. But, Americans cheap out because, they think they know better. In a lot of cases, I've been attacked by medical doctors. I'm threatened early on in my career. I would, on the old voice recorder, I would get messages saying, who do you think you are? How dare you? I'm coming after you, in total threats, because I helped their patient get well and get off meds. And I'm not saying that everybody has this capability in them to get off medications, but the thing is you should at least try. You should at least attempt to see if there's something better out there for you. So I'm very concerned about what's happening in birthing. And I'm very concerned about all the vaccines. I'm very concerned about what is happening to the children. And I'm starting to kind of see an epidemic. And I also think that it might be multi-generational, which means that it's becoming hereditary. So, you were over vaccinated, you had birth trauma, your spine, had lots of switchbacks at birth. Your mother was highly stressed out with your pregnancy, so you developed an A-type personality. You were super stressed out your whole life. And then now when you have a kid, all that becomes hereditary because, it's part of your genetics. So you're passing all of that on, and then it's compounded. You're stressed out with your pregnancy. Your baby gets all these vaccinations. Your baby has birth trauma. So not only is it hereditary, but it's compounded also again with the environment and several generations of that. I mean, can you imagine? Babies are going to be zombies from the get-go. We're going to have a whole, generational zombie, mode going on because of all the chronic hereditary situations that could have been avoided and could have been corrected. This really gets me super wound up. And I have to be nice, to parents when they come in so that they'll bring their baby in. But sometimes I want to just start screaming at them and their choices that they're making. Because, and I get that they don't get it. Because every person they go to has a different vocabulary, is using different verbiage, right? And it's done that way to confuse you. It's done that way so you don't know what the hell is going on. Like I said, the different levels of structure of healthcare, from the basic foundations all the way up, right? And they're all kind of disconnected from each other. So nobody really has a clue unless they're people like me who have studied all the different avenues, who have an education, who have done apprenticeships, and who had their own brain cancer and had their own major health problems and challenges and actually overcame them. That's another thing. Is the practitioner or doctor or whoever you're going to, have they overcome massive physical pain? Have they overcome, cancer? Have they overcome hereditary problems? Have they overcome, what have they done? Maybe, you should whip out a ditto sheet with questions so that when you go to talk to your healthcare practitioner, you have questions. You are interviewing them. They are not interviewing you because your life depends on it. And more stressful than that is, for me, the life of my animal, like my dog. And so I'm super particular. For example, I've been through 6 vets. My dog will be 7 in December because I don't like how my dog was treated. I don't like how I was treated. I don't like the force that was applied to me and the guilt and threats that were made. So I just kept going until I could find a vet who saw things the way that I did. And it turns out it's a super old school vet. And I'm happy with that. And so I don't have a lot of stress now when I have to take her into the vet for her heartworm because it's the only thing I really give her. She's been over vaccinated in her puppyhood before I got her. So my just big concern is that she has heartworm annually because I would never poison her with arsenic to kill the heartworms. Just, wouldn't do that. So The only thing that I think that is really important is the heartworm medication, right? And so because I love my dog so much and because I respect her as another being, I treat her in the way that I want to be treated by medical doctors and practitioners and other things. And so I interview everybody. And if I feel at least one bit intimidated, or they try to play this verbal game using words and terms that they don't think I know what it means, I'm out of there. I put the leash on my dog and I walk right the fuck out the door. And if I had a baby, I've never had children, but if I had a baby, oh man, a doctor had better watch out, because there's no way that I would sit back and allow someone to stab my baby with needles. I would find something else to do. I would figure out what else that could be done other than torture, maiming my child. I won't even let my dog be tortured or maimed. I mean, I don't know what is wrong with people. They're under so much mind control and cannot think for themselves, and fear because they're out of control. Their lives are out of control. Their answers and questions are out of control. They don't understand, and they don't want to take the time to understand. And you know what? Doctors don't have the answers. Sometimes they do. Rare. Right? But they say don't do any harm. They're supposed to take an oath to do no harm. They kill people all the time. They're stabbing people with needles all the time. They're doing inappropriate surgeries, exploratory surgeries. They're practicing medicine. This is what they are insured to do: practice medicine, not do medicine, not cure. So everything that they're doing is harm, right? Harm. So do your due diligence. Be an adult. Be a responsible adult. Take control of your health. Take control of your animal's health. Take control of your children's health. This is your responsibility. Don't be a child and allow other people to push you around and dictate what health is and what health care is. Get a grip. Stand up. Listen to your heart. Your heart will tell you if you are terrified, you put your baby down and they're doing things to your baby that is terrifying you and you can feel panic coming up. What would be the responsible response? Something is telling you to run. Okay? Hello? Your intuitive sixth sense is saying run, 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 run. What do? You pick your baby up and you run out the door. Because that's what your heart is telling you. That is what the signal inside of you is saying, that there's something wrong. Rely on that feeling, because it will get you through whatever you need to get through, and it will make you safe. There's this great book that I read. I took this women's self-defense class for 6 months at a college. And you learn how to fight, defend yourself. There's also a curriculum, and you read a lot of different books. The Evil That Men Do, Trespass, but there was this one fantastic book called The Gift of Fear by Gavin de Becker. And that book said every time that you feel that intuitive, you're spot on and you need to respond accordingly. Run. Get out of there. So if you have to go read The Gift of Fear by Gavin de Becker to get a backbone to deal with your own health, to deal with your children's health and your dog's health and your animal's health, please read that book. Please get in tune with your intuitive nature. And you know what? The next time you feel stressed, anxiety, panic, or fear, do the right thing. Pack it up and leave. You do not owe anybody an explanation. And if you do try to respond sometimes in the medical field, or if you're in a hospital or whatever else, they are not going to let you leave. They're going to give you a psych evaluation. So you need to just pack it up and walk out the door. You know what? If they send you a bill, fine. Pay it. Let your insurance pay it. But you have every right to leave. And you don't owe them a discussion about it, because that's what they want you to do, to discuss it, so that they can keep turning you back around to them, to staying, to doing, to being right there. So I'll leave you with this story because it's such a great story. So my teacher Bovido, who died last year, June, he's been dead a year. Wow, that's just, I can't believe how fast it's gone by. He's a Shoshone elder, medicine man. And he told me this story about he was working at a mine in one of those big, huge trucks. And because he's native, the white guys didn't like him. And so the white guys were always trying to harm him when he was young, you know. And he was driving his big truck, and one of them came rolling down the road and actually impacted the back of his truck. And the impact of it basically fractured the 3 lower lumbars in his back. And he was in so much pain, he couldn't even like snap his seatbelt off. So they had to call in care flight. And this was done because he was native. This was done as an attack on him. It was not an accident. So they get him, care flighted him, they get him to the hospital. And the doctors are like, oh yeah, you know, there's pieces like fractured off, and we're going to have to go in and remove all the bone down there. We're going to put in a like metal rod and, you know, all this other stuff. And, oh, you're never going to work again. And you're never going to, you know, live again, whatever else. And so he really thought about this. And this is not the native way, right? This is not a traditional native way. This is not how native people that are in a traditional way operate. They would pray about this stuff first, right? Or they'd go to the medicine person, or they go to the pipe carrier, or they'd go to the lodge, or they would go a lot of other places, and they would do a lot of prayer work with the Creator before they made a decision about that kind of an invasive thing. So he decided that, you know, he's out of there. So I don't remember who came and got him, but somebody came and got him. And he just left. He didn't tell him he was leaving, but, you know, he had somebody come from his reservation to pick him up, which was pretty far away. And he walked. He said it was so painful, but he willed himself to get up on his feet and walk out before they noticed that he was gone. He said because they were going to do everything. They even give him more drugs or whatever else to keep him there. You know what I mean? Because he felt like they were really over medicating him, and he was starting to kind of hallucinate, and he just didn't really want to deal with that. So he gets back to his reservation, and he had heard about a man who had multiple native drums, all different kinds of drums. And this medicine man used them to heal and cure all kinds of different things. It's called frequency medicine, right? It's activation of the brain and the energy field, right? And go and look at a lot of Coral Castle and some of those kinds of things, and what that man did with frequencies and somatics. Of frequency, where they put the salt on the drum, and then they do different sounds, and then the shapes, the geometrical shapes and patterns that the salt becomes, those are the frequencies that are going into your body, and they're changing the geometrical structure within your cells, your blood. Bovido said that our blood is crystal. It's crystals. So our bones are crystals. Everything in our bodies are crystals. So, of course, you go to a medicine man and he'd start drumming beats, different kinds of frequency beats onto your body, right? And in an hour and a half, Bovido said, all the fragments of the bones came back together, connected back to the bone, and sealed up and healed his 3 lower lumbars perfectly. He sat up, no pain, and walked out the door and never had another problem again with those 3 vertebrae. So these are things that have been used for thousands and thousands and thousands of years. You are energetic and crystalline, however you want to say it. You're just a giant quartz crystal, basically, on multiple levels in your body. He said water is, in its true state, is the crystal. Crystalline, liquid crystal. So, you know, you're what, 98% water? So there's a lot of things that could fix, and there's a lot of things that could harm. I mean, go back to being a fetus and all the stress and the fluid, right? Instead of developing in a crystal structure, a liquid crystal structure of perfection, you're developing in contaminated, harmful fluid based on where the mother's experience is. Okay, anyway, that's my about healthcare and believe it or not, doesn't matter, but I hope that this video helps you. It helps me to talk about a lot of these things because we're at a point where we need to really all make serious choices about our health because we're losing health and it's becoming hereditary. Things that are so simple to solve are becoming hereditary, which are regenerating in our offspring. And it's a very sad, unbelievable, shocking nightmare that people are engaged in because of the mind control, the languages that are used, the intimidation, whatever else. So anyway, Bridget Lynn Dolgoff, thanks for listening. Be responsible, grow up, be an adult, take control of your health care, take control of your land's health care, take control of your home's health care, take control of your children's health care, take control of all the health care. Be responsible. Do not give your choices away. Do not give your responsibility away to somebody else because they don't know you. They don't know your children. They don't know your animals. They don't know your home. They do not know your land. And you are a steward. You're responsible. Adios. Have a great day. Bye-bye.